Admiral Jim Stockdale was shot down over North Vietnam in the early 1960s. He'd be a prisoner of war for many years and tortured by the North Vietnamese more than 20 times. It left him crippled, it left him with hearing problems, and yet he came back and lived a very meaningful and significant life. Many other prisoners who had been shot down and were in that prisoner of war camp did not make it. They died. Jim Collins, in the book Good to Great, asked Admiral Stockdale, "Why did you survive and others didn't make it?" And Admiral Stockdale explained. He said, "I was willing to face the most brutal facts of the current reality that I didn't know when I was going home. But at the same time, I had an undying faith that I would survive, that I would be successful, and that when I got out, I was going to live my life in a meaningful way and turn this for good." You know, right now, the United Methodist Church needs to be doing that very same thing. We must be willing to face the most brutal facts of our current reality and have an undying faith that God is going to use us and we're going to be successful in making a difference in our society and sharing God's love and bringing hope into this world. But you have to do both things, and we have to face some very brutal facts at this time. Right now we're having to look at the issue of clergy benefits. Last year we were looking at the pension benefits for active clergy. Today we want to have to talk about health benefits for our retirees. It is a fact. The Methodist Church has been in decline for more than 40 years. There are many experts on the national level who say that in the next 15 to 20 years, the Methodist Church will close half of its churches. That within 20 years, our denomination will be half the size it is today. It is a fact that here in Oklahoma, we're experiencing some of the same trend, though maybe at a slower rate than other places around the country. Right now, we know in the last 10 years here in Oklahoma, the top 30 churches that on average pay about 50% of the apportionments have declined in average attendance on Sunday morning by 13%. If you take all of the churches that have an average attendance of 200 or more in the last 10 years, our average attendance on Sunday morning has declined by 18.5%. That's a fact. The fact is, with declining churches, there is less money. The fact is, the average age of a Methodist is getting close to 60. I know. And let me tell you, the 60s happens to be the very middle of the baby boom generation. And what that means is, over the next 20 years, we're going to have a whole lot of dying going on in the Methodist Church. And so even if we're growing, the church is going to be in a very serious decline for a number of years. There's going to be less money for years to come. That's a fact. It is a fact that we're having more retirees. We have 475 retirees right now, and in the next 10 years, that will grow by more than 50%. It is a fact that with retiree medical benefits and cost increasing, that with the amount of retirees increasing, with the church declining, with money declining, we have to do something. It is a fact that our health care program is now different. Things we can't control. Whether you like it or not, whether you are for it or against it, it's the law of the land. You have to go to exchanges now to be able to shop for insurance, and health care is going to be delivered in some new ways. It's a fact that what's facing Oklahoma is not unique. There are so many annual conferences around the country, Texas, North Texas, Central Texas, Kansas, Missouri, you name it, who've already had to face this issue and made some of these choices. We have to do something. Under the present plan, what happens is when somebody retires and they go on Medicare, we then buy a supplemental health care insurance program called through Hartford. And for all of our retirees, whenever you go get health care, you know there is no deductible and there is no copay. A retiree's prescription drug plan is actually covered through the plan that all the actives are on. Under the new proposal, what the proposal is going to be is that in the future, we're going to give every retiree and spouse $2,400. You'll be able to put that into a health reimbursement account. It's your money. If you retired in 1992 or earlier, we're going to give you $3,000 because we know you didn't have as long on the retirement program of MPP as did other people, and you were under pre-82. So you'll get $3,000. And you put this in your health retirement account. It is your money. You will then call the General Board of Pensions and Health Benefits to talk to a person. You don't have to go on a computer. You don't have to try to sort through forms and read and figure this out. You will talk to an individual, explain your situation. They will then tell you the many different options of the kinds of supplemental plans that you can purchase. That's what you use the money for. You're able to buy a plan and you decide, what do I want my deductible to be? What do I want my co-payment to be? What's going to be the cost of my prescription drugs? You discuss these things and buy the plan that you want. Some of those plans may cost more than what you've been given. You have to add the difference. Some may cost less. Then you get to keep the money in your health retirement account. And that money can then be used for your health issues and even shared between spouses. That gets to be your choice. Something different is going to happen. The fact is, last year the annual conference spent about $2.5 million on retiree medical benefits. Under the new plan, we will be spending about $1.3 million. The fact is, last year I came and talked about how we were having to cut the pension benefits for ministers who are in active participation right now. We had to do that because there were annual conferences that couldn't make that payment. But what we promised was we were not going to cut the benefits of the retirees for their pension programs. Unlike the Lutherans, who've had to cut their benefits to their retirees by 30%. We have worked hard to make sure that we are funded and that what was earned and promised in terms of your pension benefits will be continued. Last year we had to adjust what was happening in the pension benefits for the actives, but this year we have to look at how we're handling the retirement medical benefits. The fact is, we're having more retirees, and the costs are going up, and the church is declining, and there is less money. We have to do something. We wanted to do something where no one was left behind, where people still had some power to choose and make decisions right for them, and that we could care for one another as the covenant family that we've promised to be. What we are really called to do and be reminded in this crisis as we face these facts is remember, we have been called to make disciples for Jesus Christ for the transformation of the world. We have been called to go make disciples and baptizing in the name of the Father, Son, and Holy Spirit. We're called to grow. Again, the experts really say if we would focus right now on truly raising up strong young leaders, training them well, if we focused on starting new churches, if we focused on how do you staff the rural church or the small church where they're not overwhelmingly burdened by these kinds of benefits for clergy, if we could focus on how to do that, the church is still going to decline for 15 to 20 years. But then we will have strength. And at that point, we will turn and we will be able to grow. And the Methodist Church will continue its mission of reaching out, sharing God's love, and bringing hope to the world. It's up to us to have the courage to face the most brutal facts of the current reality and to have an undying faith that Christ is leading us into the future. Thank you.